Now, the health department is sounding the alarm over the increasing HIV cases. They are also making the rounds to keep students safe from dengue and even smoking. With the school opening on Monday, June 16, joining us for this discussion is Health Spokesperson, Assistant Secretary Albert Domingo. It's a beautiful day, ASEC. Thank you so much for joining us on the show. Once again, sana live next time kasi wala si Ann. We need another host.
Good morning, Paolo and Monique. Good morning. It's a beautiful day indeed. And yes, we miss you, Anne. Good morning, everyone.
All right, Doc, we have a lot of serious things to talk about. So let's start off first with the HIV cases because, well, the World Health Organization and UNAIDS supports the call to declare HIV a public health emergency. Now, with that in mind, I'm sure DOH already has certain plans to help address this. But I want to touch on a few facts that have been making the rounds online. Facts or claims, rather, that have been making the rounds online. Saying that the rise in cases here in the Philippines coincides with just better reporting or more tests being done. Is that a fair fact to make? And of course, is that a fair claim to make, rather? And of course, what is being done by DOH to try and work on what the UNAIDS has described as support for this being an emergency?
Yes, let's talk about the testing. It is true that we have better testing, but the way I would describe this is it's like what we call the flashlight effect. Before, when we say a flashlight effect, imagine there is a dark room with around 100 people inside it. And if you bring in a candle, you only get to see around 3 to 4 people kasi mahina yung candle, so just a small flame. If you bring in a small flashlight, which is probably going to illuminate the room, remember there used to be 100 people, you just saw 3 or 4. A flashlight will allow you to see maybe 10 or 15 because you're using a flashlight. That is called the flashlight effect. However, if you switch on the light in the room, you finally see, oh, there are 100 people inside the room. They've always been there, but just because of better testing or better lighting, so to speak, you get to see all of them. Now, that is true. However, it is also true that the size of the room in the case of HIV has been increasing at the same time. So while we switched from a candle to a flashlight to an overhead light, the room also kept on getting bigger. Instead of just having 100 before, there are now 150 and then 200. And then recently, it's around 250,000 people living with HIV. The testing rate has always been hovering around 60 to 70%, at its highest around 68%, Paolo. And that is the problem because how can you get people on treatment if you don't know who to get on treatment? Kasi the second stage after testing would be to get them on treatment. And then the third stage would be to make sure that they are on maintenance. We would like to say in the DOH that HIV nowadays is just like hypertension, diabetes. You just have to get tested, get your blood pressure checked. If you have high blood pressure, someone prescribes an anti-hypertensive medication, and you just keep maintaining it and you'll be fine.
Doc Albert, that's actually such an interesting analogy to talk about the rise in cases. And like you mentioned, it went up 550% since 2010, actually. Yes. So around 250,000 Filipinos are living with HIV right now. So with that being said, what measures will the department introduce to expand free and accessible HIV testing, particularly among men who have intimate relations with men and young people?
So everyone, Monique, points to stigma, and we do agree. Stigma, which is still prevalent, people not understanding what HIV is. There is still this very old 1980s mentality that it's something to be scared of. No, as we always keep on saying, the technologies, the treatment is much better nowadays, so HIV is no longer a death sentence. It's just like hypertension, it's just like diabetes. You can't treat it outright, we can't get rid of hypertension, but you can control it. I'm one of them since 24, taking losartan. So it's similar to that situation. And to answer your question directly, how do we get testing numbers to increase further beyond the 63 or so percent being tested? In fact, for 2025, it's still low at 55, but we're just halfway through the year. So we want to mainstream testing. Monique, when we say mainstream, ngayon kasi the testing is offered at specific HIV treatment centers. There be a bit of a paradox because you don't want stigma and yet you're asking people to go through centers which are publicly identified as HIV treatment centers. So there's nothing wrong. I salute these centers. I visited quite a few of them, and they're doing great. But for the greater majority of the population who might actually not be keen on going there, you have two options. Right now, you have widespread self-testing, which you can buy from the drugstore, from a licensed drugstore. And then what we're planning on doing is to allow testing at all primary care centers, including the DOH Bukas centers, the many rural health centers, and what have you in the private sector.
You mentioned the rural health centers. That actually brings me to my next question, because when we talk about the treatment, when we talk about the rollout of PrEP and PEP in particular, how well equipped are provincial and rural health facilities over in the metro, over in the metro areas in Manila, Cebu, and Davao? They are typically more well equipped, but then when you go to the outskirts, just how well equipped are they to provide services to address HIV?
So the good news when it comes to these, shall we say, drugs and commodities for HIV, they are not temperature sensitive. These are not like vaccines that you need to maintain refrigerated. PrEP is a tablet. Even post-exposure prophylaxis, antiretrovirals, they're all of the same drug class. They're pills that can be stored at room temperature, so that's good. Now, the challenge is, how do you offer the counseling? Because you don't just give PrEP left and right, just like vitamins. You have to somehow speak with the patient. You have to check on them. You also have to make sure that there are no other concomitant infections and so on. So I think that's what needs to be built up. Now, it's not hard to do. Any general practitioner can do that. So it's a matter of capacitating. And when it comes to the hospitals, they are very much trained in that. The DOH Bukas centers, which are extensions of the hospitals, can also handle that.
Thank you so much, Doc Albert, for all the HIV info. And I'm sure the stigma will lessen now that we're talking more and more about it. But now let's move on to dengue, because with the tag-ulan season right now, it's also Dengue Awareness Month, and cases are rising. It's actually double than 2023. 2,298 dengue cases have been reported in 2024 so far. And Secretary Herbosa actually warned of a potential major outbreak because of the rise in the cases earlier this year. So what steps are you guys taking, the DOH, to ensure that dengue fast lanes in hospitals remain active?
The dengue fast lanes are already at a later stage, meaning if you do have symptoms, yes, we want you to seek early consultation. But Paolo, you have to practice Monique. You have to ask her to say, taob, tak-tak, tuyo, and takip. Repeat, Monique.
Taob, tayo, tak-tak, tike. Oh my gosh, wait, what?
Doc,
Taob,
it's setting her up to fail, Doc.
You know what? Last time we interviewed you, you set me up to fail also. Fourth host na talaga.
But I hope this goes viral, because when everyone hears Monique try to say taob, tak-tak, tuyo, takip, that means we're all trying to remind everyone that the prevention starts at making sure the mosquitoes do not spread.
I don't even know what that means.
Wait,
okay,
let's let Doc finish first. Go ahead, Doc.
Okay, so the taob, tak-tak, tuyo, takip, taob, you make sure you invert any containers that are capable of gathering water. Tak-tak, paano ba to? How do you say that? Tak-tak, you literally make the sound like a tapping. So if you have
tap it, you hit it repeatedly.
Yeah, so that it's dry.
Okay.
Yeah.
And then tuyo is dry, and then takip is cover. So these 4 steps. That's why we did it in Tagalog to make it catchy. Taob, tak-tak, tuyo, takip, so that we can avoid accumulated water, because the mosquitoes are the vectors of dengue.
We have a new tongue twister
No,
na.
it's a tongue twister for you, Mo. Taob,
Taob, tak-tak,
Tak-tak,
takip,
tuyo,
tuyo.
tuyo.
Yes,
Okay.
you can invert. That's okay.
Taob, tak-tak,
You got it. You
tuyo.
got it.
She did it.
Takip.
Hindi siya
Very
makakadengue.
good.
No dengue for Mo.
All right.
I like that. That's the clip right there. No dengue fever. After Mo says taob, tak-tak, tuyo, takip, no dengue fever. There you
Yes,
go.
exactly.
Kung kaya niya, kaya nyo rin.
Ay, gusto ko yan.
Oh my gosh. Doc, when we talk about early warning systems, we did mention it a while ago that because of the spike earlier on in the year, we were all of a sudden had to be prepared almost year round. Is the early spike in terms of like getting our systems in place actually to address dengue more better prepared this year compared to previous years, considering that it feels like we've been dealing year round and not just here sa tag-ulan season po natin?
Yeah, you're spot on, Paolo. No? So remember when we also, I remember I was guesting also there, and it was the same topic, dengue, at the
Yeah.
earlier part of the year. Kasi nga it was raining, and now that we have the real rainy season upon us, I think our ring just exited the Philippine Area of Responsibility from reports.
Yeah.
So we expect more water to accumulate. And to address your earlier question, yes, we may be due for a higher spike this year for the simple reason that there are more children who have not yet been exposed to any of the 4 dengue serotypes. That's the quick explanation on why it is possible to have a higher one. But to your question, Paul, on doing better, our surveillance systems are much better. So if you notice, we are able to track now on a weekly basis or every 2 weeks. And so far, our data shows, fingers crossed, that the numbers are plateauing. It means that during the summer, when it was dry, it was going down. That's
Yeah.
good. Now we are seeing a point where the curve suddenly becomes flat, and we're just waiting. We know it will happen. We're just trying to delay it. That's why we're asking Mo to say taob tak tak tuyo takip. But when the water overwhelms us, you will see that starting to go up. And then that's when the question on the dengue fast lanes comes in.
All right, so because we know it's coming, we have to talk about PhilHealth as well in terms of financial coverage for dengue, because it is an expected rise in cases. Will there be any additional support for outpatient case management to help prevent any complications?
Well, yes. So the amount of dengue coverage package already increased. For the inpatient package, it went up. If I'm not mistaken, it used to be around just 10,000 pesos. It's now 19,500 pesos for the dengue, which is not severe. The severe one from 16,000 to 47,000. Now, Paolo, you asked the right question. What about outpatient testing? A lot of government centers offer the NS1 tests for free. Those are in public hospitals, public clinics rather.
Yeah.
And the consulta clinics can also do basic blood work, and some of them may have that. Curiously, last night I was in a private drugstore doing shopping for some other medicines. I saw the NS1 test also available, and it's roughly around 300 pesos in the private sector. So even that, you can buy it from a private drugstore at that rate. So it's very much affordable and free, even at government centers. That should allow us to test faster for dengue.
Doc, let's talk about another topic, because the reason why we talked about dengue, especially with the schools opening very soon, is because the children would be affected. But interestingly enough, DOH is also pushing for another law that would actually address children's health, that would penalize individuals who bring vapes and cigarettes to schools. Now, the department's advocating for this legislation. What is the impetus for it? What is the reason why the push for this legislation is happening?
So, Pao, logic dictates that if we ban kids from buying vape devices, what stops us from keeping them from bringing it to school? Bawal nga, they're not allowed to buy it. So, or more accurately, the law prohibits sellers from selling to minors, which means there is the intention that minors should not have access to these devices. And yet, we see a lot. I'm trying to look for an example of a USB, but the dengue devices now, I see the monitor right now. They look so colorful. They're so small. Even you would mistake that it's an USB. So dapat when we go to school, just like before when cigarettes, diba? I remember when I was a kid, if you try to bring a cigarette, you get called to the prefect of discipline's office, because why do you have a cigarette with you? Because it's not allowed. So something similar has to be done, because why are we tolerating deadly devices on kids when other devices are kumbaga heavily regulated?
Absolutely. We'll get more updates on that from you, ASEC, as it continues to develop and as it pushes through all of the channels that it needs to push through. But we just want to say, first of all, thank you so much for joining us this morning to talk about HIV, dengue, and of course, this new legislation. But before we let you go, ASEC, we have to go through it again. Could you please coach Mo one more time?
No, you don't need to coach me, ASEC.
Right.
I got it. I've been practicing. That's why I'm quiet.
All right, go.
Are we ready?
All right, go.
All right.
Let's go.
Taob, tak, tak, tuyo, takip.
Very
Right?
good! Sa taob, taktak, lo, at takip, walang dengue.
Walang dengue. So make sure you do all 4 T's. And then don't forget
Say it again.
Tuzon.
One more time.
Toog, tak-tak, tuyo, takep, Tuzon. Walang dengue.
Very good.
Oh
Nice one.
my
nice
gosh.
one.
Asek, thank you so much for joining us. We really appreciate you. Hopefully, we can have you live in the studio next time. Thank you so much.
Looking forward and good morning, Monique and Pao.
Thanks, Asek.